Thank you, Dr. Ng, very much. Now we'll turn to questions from the senators. Dr. Taylor, thank you for raising the Modernization of Opioid Treatment Access Act. Methadone for chronic pain can be prescribed by doctors and picked up at a pharmacy, but methadone for opioid use disorder it has a stigma, it's restricted. You talked about SAMHSA and ensuring that we decriminalize methadone as a treatment. Can you talk about why that is such an important step for our country to take?
Absolutely, Senator. As you know, that methadone is the only full agonist opioid treatment for opioid medication that is FDA approved for treatment of patients with opioid use disorder. It seems strange, to say the least, to put it mildly, that I, as an addiction specialist physician, board certified in addiction medicine and addiction psychiatry, would be committing a crime to prescribe a patient methadone in my office who needs methadone for treatment and stabilization of their opioid use disorder. But someone who has no training in addiction treatment, a doctor who is maybe a general family medicine physician or someone in some other specialty, as long as they have a DEA registration, can prescribe methadone in their office for pain, and can do so and have that patient go pick up that medication in a pharmacy. That does not make sense, to be honest, and that is a remnant of a really stigmatizing approach to the treatment of people with opioid use disorder. That's really the only way to understand how that came about. And so what we are trying to advocate for, and what we hope Congress will pass with the Modernizing Opioid Treatment Access Act, is to make it so that we can be very thoughtful and very careful in our approach to prescribing methadone for treatment of patients with OUD. So that it's addiction specialist physicians, defined as someone who is board certified in addiction medicine or addiction psychiatry, who can prescribe the medication in a patient in our office or in one of the other various settings in which addiction specialist physicians work. Some of those settings are actually even more carefully monitored than OTPs, so-called methadone clinics, but can prescribe to patients and then have those patients pick up that medication in a pharmacy. It just increases access to care at a time when, as was mentioned, 106,000 people died last year from overdoses. We have to increase access to care.
Thank you, Dr. Taylor. And I want to, with the unanimous consent, enter into the record 2 letters from 94 supporting organizations and other clinicians supporting expanding access to methadone and to pass the Modernizing Opioid Treatment Access Act. So without objections, so ordered. Social media, its role in creating this teenage young people mental health crisis in our country. Love to hear any of you step up and speak about this and what you believe the correlation is. Dr. Celli, would you like to take that on?
Sure. This one hits close to home as I have 2 teenagers and a preteen at home. But I think what we have observed is that social media distracts children. It's extraordinarily appealing and gives instant gratification for the desire to connect with somebody. Now, this was happening prior to the pandemic, but of course, during the pandemic, in a time where children were isolated, had to remain at home, in many cases were not in their school settings, they were not practicing social skills. And so it's much, the anecdotes that I will hear in the office or from behavioral health clinicians who are seeing teens where I work is that, it takes 1 second for a child to put in friend into some sort of platform where they can connect with other peers, and instantly friends come up and they begin to connect. But these are not actual practiced social skills sort of relationships. And what's what I think is appealing is that it's so instant, and it can be very engrossing. As a result, the adolescents and children are feeling more isolated. And in fact, I mean, we call these social skills because they're skills that need to be practiced. And so I think this is impacting how our children are, whether or not they're connecting with their peers and how they're feeling about themselves.
Thank you, Doctor, so much. Yeah, it's unbelievable. 1 in 3 teenage girls contemplated suicide last year. 1 in 10 teenage girls attempted suicide last year. 1 in 5 LGBTQ youth attempted suicide last year. Social media is implicated. It's an accessory to this tragedy that we're seeing in our country, and we have to do something. We need a teenage privacy bill of rights online. We just have to pass one this year. It's urgent. Thank you. Senator Marshall.